Time now is 11 minutes past 7. Let's go back to one of our main stories this morning. It's a rare bacterial infection. It's killed 12 people in Essex, and health officials say they fear there could be more deaths from what's known as Strep A.
Now, this bacteria can live on hands or the throat, and it's spread through sneezing, kissing and skin contact. Most affected have been the elderly, and the NHS says it's taking every possible step to protect the community. Let's
go through what we know so far. More than 700 people have now been tested for the infection. 32 cases have been confirmed, and according to the latest figures, a total of 12 people have died.
Professor Shiranee Sriskandan is from Imperial College London and joins us now. Good morning to you.
Good morning.
Why do you think we're having to talk about this now? We're seeing these cases, 12 people have died, hundreds more being affected. What would be the cause of this?
Well, Group A strep, or Strep A, has always been a really virulent bacterial pathogen. So we do from time to time see, sadly, outbreaks or clusters like this, particularly in vulnerable groups of people and also, sadly, in healthcare settings. So on its own, it's not unusual. What is unusual, I suppose, is the number of patients affected. But Group A strep sadly does affect up to about 2,000 people a year in England and Wales in the invasive disease form. So it's not something that's completely unexpected. But I think perhaps what is unusual in this case is the number of people who've been affected. But they are all elderly, and the elderly are the people that are more vulnerable, I suppose, to this infection.
How does it work? We briefly explained it's a bacteria that can live in the throat or on the hands.
Yeah, so it's a bacterium that normally causes strep throat or tonsillitis or perhaps even scarlet fever, mostly in children. It can cause skin infections like impetigo, but very, very rarely it can also cause these more deep-seated infections when the bacterium enters the deeper tissues or the bloodstream through breaks in the skin. And I suppose the elderly are more vulnerable, in part because their immune systems are less strong than younger people, but also because they're more prone to have these skin breaks, particularly skin breakdown in those who are bedbound. And then finally, sometimes the features of severe infection, sepsis, the sort of a fulminant inflammatory syndrome that can be triggered by infection, is much harder to spot when you're elderly and bedbound already, and perhaps, you know, already showing some of the features of sepsis due to other conditions that you might have.
Obviously, there's no need to cause panic about this, even though we are talking about an increased number of deaths from this, as you've made clear, mainly with the elderly. It is contagious, though, isn't it? So what do people need to be mindful of while this is around?
Yes, indeed. So it is a particularly infectious bacteria, but I think the general community need not be worried. I don't think the risk to the wider public is any greater than it would have been in a normal year. But I think if you're caring for somebody who's elderly and vulnerable, perhaps who already has skin breaks, it's wise to adopt a sensible hygiene approach with, you know, washing your hands and using clean utensils and not showing facilities. I think it's more in the healthcare setting where we need to be more vigilant about identifying patients early who might have an infection and treating them promptly, and then mounting a more vigorous approach, I suppose, to hygiene in the way that we approach caring for elderly patients.
Professor of Infectious Diseases, Shiranee Sriskandan, thank you very much at Imperial College. Thank you very much for talking.